Hello, and welcome to Immunize Texas TV. Today we're talking about how vaccines help build your child's health. Every year, millions of parents make sure their children receive all of their vaccines. It's incredible. Just a few decades ago, many of the vaccines we have today didn't even exist. Without them, thousands of children contracted potentially deadly diseases like measles and polio. Thanks to modern medicine, today our children are better protected against diseases. There are a number of different vaccines, and they're given at times indicated by the recommended immunization schedule. This schedule is an important tool to help parents ensure their children get their vaccines on time, every time. To learn more about vaccines and understand their importance, we talk to both doctors and parents.
At this doctor's home, the day starts out just like any other. Waking up babies, feeding them breakfast, and getting them off to daycare. And at the doctor's office, it's also business as usual. Babies in the sick room, babies in the well room, sniffles, colds, and the expected vaccine or two are right around the corner. Gone are most of the diseases vaccines protect our children against. Illnesses that used to cause doctors, parents, and children sleepless nights not long ago. Thanks to vaccines, our children are protected. We need to continue to protect them. It's amazing. One moment they're getting their vaccines, and the next they're playing and laughing, stronger and better protected against vaccine-preventable diseases.
I'm not just a doctor, I'm a parent too. And I've got to say I'm grateful vaccines are a part of our lives nowadays. There was a very different time when doctors, parents, and children dealt with some terrible diseases. Vaccines have changed our lives for the better. A few minutes of a parent's time can make a lifetime of difference for their children.
Are some vaccines more important than others, Doctor?
All vaccines are very important. We'd like to think of immunity as a tower of blocks, similar to the kind children play with. Each vaccine is like a block in the tower. Each vaccine has to be given in the right order and at the right time in order to build the child's immunity.
You know, it's hard not to have fun when there are kids involved, but keeping up to date with children's vaccinations is important. It's of vital importance that children receive all of their vaccines at the appropriate recommended times. I spoke to Dr. Susan Penfield with the Texas Department of State Health Services about it.
Following the recommended immunization schedule is extremely important. One of the vaccines most often overlooked is that fourth DTaP vaccine. It protects children against diphtheria, tetanus, and pertussis, which are all serious diseases. Diphtheria causes a thick coating in the nose or throat. Diphtheria can lead to breathing problems, heart failure, paralysis, or death. Tetanus causes severe muscle spasms and can even cause death. Pertussis causes serious coughing spells that make it hard to breathe. In babies, pertussis can cause death.
Doctor, why is the fourth DTaP vaccine so important? And why do so many people miss it?
It takes 4 doses of the vaccine to build a child's immunity. The fourth DTaP vaccine is due between 15 and 18 months. Although 15 months and 18 months are times when well-child checks are recommended, some parents miss taking their children to see the doctor at these times. They typically go in for their 1-year-old well check and their 2-year well check. In between those checks, if they don't go to the doctor for a pressing medical need, it's easy to forget to ask for the fourth DTaP vaccine. That is why their doctor needs to make sure there are no missed opportunities to give the vaccines on time, including the fourth DTaP vaccine.
What can parents do to remember? Are there any tools to help them remember the times to give vaccines?
Timing is important. That's why keeping those well checks is important. Getting the recommended immunization schedule, posting it in your home, and following it is one way to remember to take your children to get all their vaccines on time, every time.
Thank you for joining us, Doctor. And thank you for listening. We'll be right back after this important message.
Vaccines build your child's health, just like building blocks can make a wall or a tower. One by one, they strengthen your child's immunity against life-threatening diseases. Talk to your doctor to make sure your children receive the fourth DTaP vaccine at 15 to 18 months of age. For a copy of the recommended immunization schedule, call 1-800-252-9152.
We met a family who had just scheduled their baby for the 4th DTaP vaccine. We are accompanying them on their visit to the doctor.
So how did you remember Sophia was due for the 4th DTaP vaccine?
Well, my wife is really good about keeping up with the recommended immunization schedule. She called the Department of State Health Services at 1-800-252-9152 to get a free copy of the schedule. And we got a magnet with a copy of the recommended immunization schedule, and she posted it on the fridge, and here we are. We remembered.
Sophia's looking happy there, Mom.
She's a great baby girl.
Thank you for making sure your children are vaccinated.
I think any mom would agree. Vaccines are safe and effective. And vaccines could save her life. Hi. Hi, good afternoon. I have an appointment for Sophia.
Hi, Sophia. You ready to see the doctor? Okay, let's go.
Thank you.
What do you think about the 4th DTaP vaccine?
It's my favorite vaccine
Oh, really? Why?
because we get to see the babies again before they turn 2. To ensure that the babies receive the 4th DTaP, we like to give the vaccine at one of the 15 months or 18 months well checks. It was really nice to see them when they received their other vaccines at 2, 4, and 6 months, as well as 12 months. Now, at 15 to 18 months, we see them again when the 4th DTaP vaccine in the series is given.
Thank you.
It's heartwarming to see families taking care of their children. And as Mom says, it could save their lives. Over the years, vaccines have reduced the incidence of serious diseases such as measles and polio in our young children dramatically. Still, the work continues. To protect your child, vaccinate them on time, every time. Until these diseases no longer exist, protecting children against their potential danger is extremely important. Most vaccines are completed in early childhood. There are other vaccines that are given in adolescent years to provide protection from additional diseases. Always discuss with your doctor what vaccines your child should receive, regardless of their age. We'll be back in a moment.
Each vaccine your children get builds their immunity. Your babies should receive vaccines at 2, 4, and 6 months, as well as 12 and 15 to 18 months of age. Talk to your doctor to make sure your children receive the 4th DTaP vaccine at 15 to 18 months of age. For a copy of the recommended immunization schedule, call 1-800-252-9152.
In our closing segment, we follow Dr. Avila Edwards back home after caring for her patients.
And watermelon? Let's see. Boing. This is why I make sure that all children, including you, receive their immunizations on time every time so they can grow healthy and strong.
After a busy day at the office, the doctor's work continues as a parent. Doctor, does it give you peace of mind to know that your children are protected by vaccines?
Absolutely. There are so many things in life we can't predict, but we can protect our children against diseases with vaccines. I sleep so much better at night knowing that my patients and my own children are protected by vaccines.
Each vaccine your children get builds their immunity. One of the most important vaccines is the 4th dose of the DTaP vaccine at 15 to 18 months of age. Talk to your doctor to make sure your children receive their vaccines on time, every time. For a copy of the recommended immunization schedule, call 1-800-252-9152.
Every day is a full day for most parents with young children. But today we learned the value of taking the time to get children all of their vaccines on time, every time. Every vaccine counts. So keep up to date. vaccinate. Remember, the 4th DTaP vaccine is due at 15 to 18 months. Ask your doctor about it. Get a copy of the recommended immunization schedule. Post it. Follow it. That's all for today from Immunize Texas TV. Thank you. And remember, vaccines build your child's health.